We've talked about some of the common cancers with Dignity Health Cancer Institute at St. Joe Hospital and Medical Center, but there's one that people might pass off as sleeping wrong or pulling a muscle, and that is head and neck cancer. And here to tell us more about it is Dr. Diaz and Dr. Santarelli. How are you two doing?
Good morning.
Santarelli.
Good morning. Santarelli, thank you.
How are you two doing today?
Very well.
So this is very interesting because, as I said, people don't think about neck and head cancer. You know, they think, of course, the typical cancer we have from lungs and prostate and everything. But let's talk about this, Dr. Diaz. Cancer is a broad term, and so in a nutshell, tell me how this cancer occurs.
So basically, this is a cancer that can be seen in the nose, in the sinuses, in the throat, right behind the mouth, in the mouth itself, in the voice box, or in the neck, and sometimes that's itself show up like a little bump or lump in the neck. You know?
And we're going to talk about that in just a bit, but let me ask you this. You said the sinuses. So is that like when I'm having allergies and stuff, I might think it's sinuses, but it's something else?
Yeah, like for example, you know, you can have like a sinusitis that keeps coming back and keeps coming back, and then you start having a little discharge, you know, a little mucus coming out, maybe some blood coming out, you know. Then you know, that's kind of how it shows up.
Yeah, and please don't get too scared out there, people, but that's why the doctors are here to talk about that, because some people might be having that and they do know it's sinuses, but there's other things that contribute to that. And so if I am having that, when will I start to see a little more in my sinuses and my neck and stuff? Will I start to see other little things?
Yes. So in addition to that, sometimes you will get like hoarseness. That's a big sign of head and neck cancer. Yeah. It could also be all of a sudden you feel a lump that starts growing in your neck. You could have a little ulceration, you know, a little area in the mouth, for example, that doesn't heal. And as you can see, it just keeps progressing. One of the things that I like to say is, if you have something that comes and goes, it's not that. But if something becomes persistent, that's the point. If something is persistent, continuous, and it doesn't go away, that's when you probably should start thinking about it.
And talking to my doctor. Dr. Santarelli, I want to talk to you about chewing tobacco, because we've heard about this over and over about chewing tobacco. But is that one cause of neck and head cancer a little bit?
Yeah, so traditionally, the largest driving factors for head and neck cancer have been tobacco and alcohol product usage. However, there's everyday more common risk factors that we look for in a patient's history. People over the age of 40 are at risk. Men have a 2 to 3 times greater incidence of cancer than women. People that have poor oral hygiene, poor oral nutritional status, those are patients we tend to look at also with increased risk. And so our goal is to identify patients that could have potential driving forces that spur on these cancer formations. And one of the big things we've been seeing in the last 2 to 3 decades is infectious mediated cancer. And so HPV, which is an infectious process, is a very large driving force for a lot of these cancers that we see. Not all HPVs are the same. Some have a higher potential for forming cancer, and ultimately our goal is to screen patients and determine which of these put a patient at potential risk.
Yeah, and we've been in this, as we say, the pandemic. We're still kind of coming out of it, and people are not addressing these things because, again, they're kind of like, well, it bypassed or anything like that. But this is a time now to really start looking at things. And so we talked about some of the symptoms here, Dr. Diaz. So let's touch more on some of the symptoms. I know people are kind of getting a little worried maybe at home. Oh my goodness, I have sinuses, I have this neck thing. But what are some other symptoms that we should start looking at too?
So there are other things, you know, like if you notice that there are some discoloration in the mouth, something like a little red area or a little white area. If you have, like I said before, an ulcer that does not go away in the mouth. One of the things that I think I recommend patients do is they should probably be evaluated by the dentist. I would say at least once a year, because to be honest, many times the dentists are the ones that find this kind of issues, right? Because they'll be seeing your mouth once a year, they get to know you, and they see that something is changing, that there's like a little bump or a little lump, a little ulceration that's not going away. And they can catch up on that, I mean, many times.
Yeah. Let's talk about treatments, because that's another thing people are now wondering about. How is this treated? How do you guys go about to taking care of this cancer?
Yeah, we like to individualize everyone's care. Not all 2 people are the same. And so it's a process of getting the appropriate workup, the appropriate testing, because we want to give you your best chance at beating this. And something that involves a comprehensive, multidisciplinary team is really important to this process. Yeah. And in 2022, medicine is a team sport, and all hands have to be on deck, not even just from the patient's perspective, but also the providers involved.
Yeah, at Dignity Health, basically, at the Cancer Institute, we basically have multidisciplinary teams that with tumor boards and multidisciplinary clinics, where we actually look at all of our cases and we come up with a treatment plan, like he said, which is multidisciplinary. All of the different people are there. The medical oncologist, the radiation oncologist, and the ENT surgeon, as well as others, participate in making the decisions as to how we're going to treat this particular patient.
Yeah. And I think what's great about Dignity Health is that it's, like you said, a whole team. So if a doctor's looking at you because you might think you might have prostate cancer, and then they go, no, you know what, this is maybe neck or somewhere, and we have the specialist for you. So everybody's right there.
That's
so,
right.
Doctor, thanks for coming in and talking to us about that. And so it's very important. And if you are at home wondering more about, of course, head, neck, and cancer, you can go to aztv.com, and we'll have Dignity Health Cancer Institute information right there for you to check out and see. So thank you, doctors.
Thank you.
All right, we got more mixed right after this.